Alright, so I'm going to be doing a respiratory exam here on Michael. And one of the things I'm going to look for in this respiratory exam is how much his chest wall elevates and then goes back down. So that's the main thing I'm going to be looking for, counting his respiratory rate per minute. A normal respiratory rate per minute is about 12 to 20 respirations. So in order to do an exam of his respiratory rate, I'm going to grab his hand, put it over his chest, and I'm going to look for any type of chest elevation. If I'm having a hard time looking for chest elevation, another technique you can do is just putting your hand under their nose and just feeling for breaths. Another good technique when doing this is to also do their blood pressure, or give the thought that you're going to do their blood pressure so that they don't alter their respiratory rate in any way. So what I'm going to do is I'm just going to act like I'm doing blood pressure, and I'm just going to be counting his respiratory rate. And I'm just going to be looking for that elevation there. And there you go, there's one. So we already did this test earlier, and he has a respiratory rate of about 12 respiratory rates per minute, which is pretty normal. A lower respiratory rate per minute you'll typically see in like endurance athletes, which isn't typically a bad thing. A higher respiratory rate can be indicative of a lot of different things like arthritis, asthma, or any other type of infectious disease. So yeah, that's respiratory rate. Alright, so we'll be doing a pulse exam on Michael here. And first thing you want to do is just grab his arm, make sure he's in a rested position, and just put your hands over his radial pulse. And what we're going to be doing is getting a beats per minute on Michael. So we're going to go up to 30 seconds and just get as many beats as we can for those 30 seconds, and then we're going to times it by 2. I already did this with Michael earlier, and I got a 74 beat per minute. That's pretty normal. That's where you want your range to be, between 60 and 80. If you get it typically over 80, you're going to have something called tachycardia, which is indicative of like blood pressure type of diseases like hypertension, like diabetes, things of that nature. A lower beat per minute, like anything under 60, you tend to get this what's called bradycardia. And what that can indicate is just either the athlete is very, you tend to deal with a lot of athletes in our setting, so you can get a lower beat per minute. So it's pretty normal to get bradycardia in our patients. Alright, so we're going to be doing a blood pressure examination on Michael here. First thing you want to do is make sure you have a cuff that is of appropriate size. Looks like large will be fine just for Michael. So yeah, one of the first things we're going to do is look for that brachial artery pulse. It should be on the medial side of the arm right here. Just got to look for it. Alright, looks like it's right about here. I found it. Alright, now what we're going to do is find a little artery marker on the cuff, and we're just going to line it up right there. About right there. And I'm just going to grab this, and I'm just going to slap this thing as tight as I can. And I'm going to grab the marker here. I'm just going to slip it in right here so I can look at the millimeters per mercury I am pumping. And then first thing I'm going to do is make sure I look out for the oscillatory zone, and oscillatory gap, I mean. And so we're going to pump him up all the way until I cannot feel his radial pulse anymore. So let's just pump my boy up. Oh, make sure it's closed. It's a good idea. So about 180 millimeters per mercury is where I'm going to find that his oscillatory zone's at. So we're going to deflate him. All the way. And now we start the actual blood pressure. I'm going to put the stethoscope on, make sure it's on correctly. You can hear it. All right. gonna put it right on his brachial pulse, which is about right here. Gonna make sure this is closed. All right. And then I'm gonna hold this down on his brachial pulse. And one thing you want to make sure you don't do is put your thumb over it, or else you'll end up taking your the blood pulse of your thumb. So let's pump it up all the way up to 200. And then I want to release at about a rate of about 2 millimeters per mercury per second. Then I'm looking for that first noise. Then I'm looking for that the last noise when it disappears. That'll be his diastolic. So it looks like Michael's at about 132 over 74-ish. Is probably in that area is where I'm looking for Michael. That's not too bad. It's kind of normal. What you're looking for typically is 120 over 80. Anything over in that like 140 to 90 zone, you'll start to get pre-hypertension. You'll start to get like a stage 1 hypertension, which is really bad. That can be things like diabetes, high blood pressure, cholesterol, things like that. And then typically lower blood pressures don't tend to be a problem, as most athletes that you get are conditioned and they'll have a lower blood pressure by default. So yeah, looks like Michael's fine. All right, so I'm going to be doing an oral temperature here of Michael. And to start off this exam, I'm going to need Michael to open up his mouth. And I'm going to put this right under his tongue. He's going to close it down. And what I'm going to do is I'm just going to click this button. And I'm going to wait until it either beeps or I'm going to wait for about a minute. So right now we just wait. Alright, so now it's beeping. It looks like Michael's about 98 degrees Fahrenheit. We want to stay within the range of about 95.9 degrees Fahrenheit and 99 degrees Fahrenheit. And he's at 98 degrees Fahrenheit, so he's well within his range. So he's fine. Anything over 99 degrees Fahrenheit, you start to get hyperthermia, which is just increasing heat in the body. And then anything under, you'll start to experience hypothermia. Anything under about 95.9 degrees Fahrenheit, you start to get hypothermia. So yeah, those are the abnormalities acquainted with a low temperature and a high temperature. Alright, so I'm going to be doing an ear examination here of Michael. One of the first things I want to do is just check the light of the otoscope, and it looks like it works pretty well. And second thing I'm going to want to do is just pull back Michael's ear, just so I can get a clear view of the tympanic membrane, his ear canal. And then I'm going to, so one of the things so there's going to be two things I'm looking for here. I'm going to be looking for any white spots of the tympanic membrane. It could indicate tympanic sclerosis. And then I'm going to be looking for any, I'll be looking for three things actually. I'll be looking for any holes in the tympanic membrane, and I'll be looking for any excessive earwax that could indicate to patients like hearing loss or decreased hearing. So I'm just going to stick this in here, the otoscope, and stick it inside, and then I'm going to put on the light. And then I'm just going to look through Michael's ear canal. And he has some earwax, but it looks like it's nothing excessive. And he has no white spots in the back. I don't see any holes in his tympanic membrane. So just based on the evaluation of his ear, I'd say it's pretty normal. So yeah.